There are some early signs and symptoms of type 2 diabetes, and the most common ones are extreme tiredness, so this is tiredness beyond normal levels, going to the toilet more often. This can become especially apparent during the night if it's actually waking you up so that you have to go. Excess thirst, so just constantly drinking and not being able to satiate that thirst, and also unexplained weight loss. So this is different to weight loss if you've made changes to your diet, but if you haven't made changes to your diet and you are noticing weight loss, it's a really good idea to get checked out. Having said all of that, not everybody experiences symptoms of type 2 diabetes. So if you think you might be at risk, it's always worth getting a blood test and checking for sure. Your diet can help prevent and manage type 2 diabetes in so many ways. In terms of the prevention, if we are able to eat well and limit our weight gain, many people can go on to avoid developing diabetes in the first place. Once you have diabetes, if you're aware of the right types of food, but also the right portion size of those foods, we can really help manage your weight and your blood glucose levels, and those in turn will help each other. As a dietitian, I would never say there are foods that you have to eat or have to avoid in order to manage your diabetes. What I would say is that if you can try to limit your intake of sugar and very white, processed, refined carbohydrates, this would be really helpful. In addition to that, try and make sure that you're eating whole grain carbohydrates, lean proteins such as chicken and fish, and always plenty of vegetables. Physical activity or exercise can have a really big impact on the management of type 2 diabetes. When we do any form of movement, our muscles use up the sugar that's circulating in the bloodstream and lowers our overall levels. And this can be really important for people, especially after meals. More long-term than that, what we know is that it reduces our body's insulin resistance. And many people with type 2 diabetes are suffering from insulin resistance, usually caused by excess weight across our midsection. In those cases, the body doesn't respond as well to the insulin, hence the sugar levels increase. When we do any kind of physical activity, our body becomes much more sensitive to this insulin, and therefore our insulin becomes a lot more effective, and our management of type 2 diabetes also improves. Whilst we don't say that type 2 diabetes can officially be reversed, what we do say is that we can put it into remission. And what that means is being able to reduce our blood sugar levels into the normal range with no medication for a minimum of 3 months. Many people don't like this idea because they want to reverse their diabetes. But what we actually know is the most important thing is to have normal blood glucose levels and minimize our risk of long-term complications.